Have you ever been jolted awake in the middle of the night by a sharp stabbing pain in your leg? A cramp so intense it leaves you frozen in place, gripping the sheets in pain, wondering what just happened. You're not alone. Every night, millions of people, especially adults over 40, experience sudden leg cramps that disrupt their sleep, their peace, and often their confidence in their own body. Some think it's just stress, others blame aging, and many simply accept it as something they have to live with. But that's not the truth. These cramps aren't just random or inevitable. They're often warning signs, signals your body is trying to send telling you something's not right. The real tragedy: most people don't even know what their body is trying to say. In this video, you'll discover 7 medically grounded causes of leg cramps, along with 7 proven practical cures. Each cause will be explained clearly, followed immediately by a solution you can apply. Some are harmless. Others could be signs of something much more serious. Cause 1. Low salt intake. For decades, we've been told that salt is dangerous. Cut back on salt, they said. It causes high blood pressure, heart disease, and a host of other problems. But what if that advice was wrong, or at the very least oversimplified? The truth is, your body needs salt. Every cell, every muscle contraction, every nerve signal depends on the delicate balance of sodium in your system. And yet millions of people, especially health-conscious adults, are unknowingly depriving their bodies of this essential mineral. One of the earliest signs: leg cramps, often at night without warning. If you're eating a low-sodium diet, avoiding processed foods, or following older dietary guidelines, you may not be getting enough salt to support your body's needs. Symptoms may include muscle tightness, spasms, dizziness, or even general fatigue. Many people ask, "Isn't salt dangerous for my heart?" The answer isn't black and white. Excess refined salt found in processed foods and junk meals may contribute to issues, especially when paired with low potassium. But real salt, mined from ancient seabeds or harvested unrefined, contains minerals your body craves. The real problem is not the salt itself, but the type and the context. Table salt in superstores is often bleached, stripped, and loaded with anti-caking agents like dextrose or aluminum. These additives do nothing for your health. In contrast, real salt may clump. That's normal? That's natural. It's a sign that it hasn't been chemically altered. Another concern is modern ocean salt, which can contain microplastics due to pollution. These particles are invisible, but their long-term impact on your health is still being studied. That's why switching to salt sourced from ancient seabeds or brands that test for purity is essential. Still unsure? Here's a practical step. Simply listen to your body. Salt your food to taste. Craving salt can be your body's way of crying for balance. If you're active sweating often or experiencing nighttime cramps, increasing your salt intake with a clean source may be the simplest solution you've been missing. Cause 2. Electrolyte imbalance. Magnesium, potassium, calcium, arachidonic acid. Imagine trying to start your car with no battery. That's what your muscles experience when they don't have the proper balance of electrolytes. Magnesium, potassium, and calcium aren't just vitamins, they're conductors of muscle function. And yet nearly every adult today, no matter their diet, is chronically deficient in one or more of these. Magnesium is required for over 300 enzymatic reactions in the body, including muscle relaxation. Potassium helps regulate nerve signals and fluid balance inside your cells. Calcium supports muscle contraction and bone strength, but the story doesn't end there. A lesser-known fatty acid, arachidonic acid, plays a key role in helping calcium actually enter your muscle cells. Without it, your muscles can't properly contract or relax. So, what causes this widespread deficiency? For starters, modern agriculture has depleted soils of magnesium and potassium. Even if you eat greens daily, the nutrient density may not be what it was 50 years ago. Many people think, "I eat clean, how can I be deficient?" But deficiencies can occur silently. Muscle twitches, fatigue, irregular heartbeat, or persistent leg cramps may all signal an underlying imbalance. To restore equilibrium, start with food. Sardines, anchovies, and other small bony fish are excellent sources of bioavailable calcium. Leafy greens like spinach, kale, and Swiss chard offer both magnesium and potassium. However, even with a nutrient-dense diet, many people require electrolyte supplementation. An effective strategy. Add concentrated electrolyte drops into your water, coffee, or tea throughout the day. Choose a clean product with no sugar, no dyes, and no artificial flavorings. For arachidonic acid, focus on eating more fatty meats, including red meat, poultry, and seafood. It's not just about protein. Fatty cuts provide critical support for your cells and hormones. Arachidonic acid, though less discussed, plays a powerful backstage role in your body's muscle coordination. People often ask, should I take a calcium supplement? The answer, not unless advised by your doctor. Calcium is best absorbed through real food, especially when paired with magnesium and fat. Be cautious with oversupplementation. Too much calcium without enough magnesium can create new problems like kidney stones or muscle stiffness. A good rule of thumb, eat more nutrient-dense foods, supplement mindfully, and observe your body's response. If leg cramps are disrupting your sleep or slowing you down, electrolyte balance may be the silent culprit behind it all. Addressing it may be the simplest, most powerful move you can make. Cause 3. Temporary overexertion. Sometimes leg cramps aren't caused by what you're lacking, but by what you suddenly demand of your body. Picture this, you've been relatively sedentary for weeks, maybe even months. Then one weekend you join a friend for a long uphill hike or spend hours doing yard work. That night, without warning, your legs seize up. The muscles scream. You sit upright in pain, wondering what went wrong. The answer? Overexertion. When you push your muscles beyond their accustomed workload, especially without adequate warm-up or hydration, they react with tightness, spasm, and fatigue. This type of cramp isn't necessarily dangerous. In fact, it's a normal response to stress. But if your lifestyle includes long periods of inactivity followed by sudden bursts of effort, your risk for cramping increases dramatically. The symptoms can include delayed onset soreness, tight calves, sharp nighttime spasms, and even minor swelling. Some people interpret this as a sign that something is medically wrong. Others feel discouraged and avoid future activity. That's a mistake. Physical activity, when consistent and moderate, is one of the most powerful tools for preventing leg cramps, not causing them. The solution here isn't to avoid exercise. It's to engage in it regularly, progressively, and wisely. Begin with gentle movement, daily walks, light stretching, low-impact exercises. Warm up before activity and cool down afterward. Stay hydrated throughout the day, and if you've just done a physically intense task, consider taking an Epsom salt bath or using a foam roller to release muscle tension. A common question is, do I need to see a doctor if I get cramps after physical work? The answer, not necessarily, unless the pain is prolonged, severe, or accompanied by swelling, redness, or weakness. Otherwise, your body is simply adapting to new demands. Reassure yourself this is a sign of growth, not decline. With gradual conditioning, your muscles become stronger, more resilient, and far less likely to cramp in the future. Cause 4. Medication home. Side effects. Your leg cramps might not be caused by your diet, hydration, or activity, but by something in your medicine cabinet. Many common medications, including those prescribed for cholesterol, mood, pain, and blood pressure, have a little-known side effect, muscle cramps. One of the most frequent culprits, statins. These cholesterol-lowering drugs, such as Lipitor, Crestor, or Zocor, are known to cause muscle pain, weakness, and night cramps in a significant number of users. While they're often prescribed to reduce the risk of heart disease, not everyone tolerates them well. You might feel fine for months, then begin waking up with tight calves or restless legs. Another class of medications to watch is SSRIs, used to treat depression and anxiety. Drugs like Celexa or Prozac can subtly interfere with muscle and nerve function. Add to that the long-term use of over-the-counter painkillers like ibuprofen or naproxen, and you've got a recipe for hidden tension in the legs. Anti-inflammatory drugs, while effective short-term, can alter fluid retention and mineral balance, both of which impact your muscles' ability to contract and release smoothly. Calcium channel blockers, often used for blood pressure, are another concern. They not only affect blood vessels, but also influence calcium flow in skeletal muscle. This can disrupt the normal contraction-relaxation rhythm, leading to cramps. And certain antibiotics, such as ciprofloxacin, are linked to tendon pain, muscle spasms, and even long-term joint damage in sensitive individuals. Patients often ask, why would a drug meant for my heartburn or infection cause cramps in my legs? The answer lies in systemic effects. Medications rarely act on just one part of the body. They affect multiple systems, including muscles, nerves, and electrolyte regulation. Here's what you can do first: never stop medication abruptly. If you suspect a drug is causing your cramps, talk to your doctor. Keep a journal of when the cramps occur, their intensity, and any new meds you've started or changed. Ask whether alternatives exist, especially if the cramps are affecting your sleep or mobility. Most importantly, don't dismiss muscle cramps as just aging if they started shortly after a medication change. Your body is speaking. Your job is to listen and to seek support from a healthcare provider who will take your symptoms seriously. Cause 5. Deep vein thrombosis (DVT). Not all leg cramps are harmless. In some cases, a cramp in your leg could be your body sounding a medical alarm, one that should never be ignored. One such condition is deep vein thrombosis, or DVT. Unlike other causes on this list, DVT is not a muscle issue. It's a blood clot that forms in one of the deep veins of your leg, usually in the calf or thigh. This condition is dangerous because the clot can break loose and travel to your lungs, causing a pulmonary embolism, which can be life-threatening. What makes DVT tricky is that the symptoms can appear subtle at first, often mistaken for muscle cramps. You might feel tightness or throbbing in one leg, usually when walking or standing. The discomfort can come and go, growing worse with time. Some people notice swelling warmth or a reddish hue to the skin over the affected area. But not everyone experiences all of these signs. The key difference between a DVT cramp and a typical muscle cramp is location persistence and pattern. If the cramp occurs in only one leg and seems to get worse when you walk, rest, or elevate your leg, that's a red flag. If it lingers for days or feels different from usual, don't ignore it. Too often, people dismiss this discomfort as just a pulled muscle or poor circulation. But with DVT, time is of the essence. The sooner it's diagnosed, the safer your outcome. The gold standard for detecting DVT is a venous Doppler ultrasound, a painless, non-invasive scan that looks deep inside the veins of your legs. If the clot is detected early, treatment usually involves medication to thin the blood and prevent the clot from growing. Left untreated, DVT can escalate into a serious emergency. Some viewers ask, can I get DVT even if I'm healthy? The answer is yes, especially if you've recently had surgery, sat for long periods, like on a flight, experienced trauma, or take certain medications. Other risk factors include smoking, hormone therapy, obesity, and a family history of clotting disorders. If you've had a cramp in one leg that won't go away or gets worse over time, it's not worth the risk to wait. See your doctor. Ask for a Doppler scan. Better to rule it out early than deal with consequences later. Leg cramps are common, but when it's DVT, quick action can save your life. To cause 6, arterial blockage, peripheral artery disease, PAD. Another serious but often overlooked cause of leg cramps is peripheral artery disease, or PAD. Unlike DVT, which affects veins, PAD involves the narrowing or blockage of arteries, the blood vessels responsible for carrying oxygen-rich blood from your heart to your legs and feet. When those arteries become restricted, your muscles begin to starve for oxygen, especially during movement. The result: cramping pain, often described as tightness or heaviness, that begins when you walk and disappears when you rest. This is known as claudication, and it's a classic symptom of PAD. Many people assume leg cramps at night are just due to dehydration or mineral loss. But if your legs ache after walking short distances or feel cold and weak, especially if you have a history of diabetes, smoking, or high blood pressure. PAD could be the hidden culprit. What's most concerning is that many sufferers don't realize they have PAD until it progresses significantly. It's a silent creeping condition, damaging circulation inch by inch. In advanced cases, PAD can lead to foot ulcers, chronic pain infections, and even limb loss. The symptoms to watch for include cramping in the calves, thighs, or buttocks while walking, leg numbness or weakness, slow healing wounds on feet, and shiny or pale skin on the legs. Some people even report cramps while lying down, relieved only when they dangle their legs over the side of the bed. The risk factors are well documented: smoking, diabetes, elevated cholesterol, sedentary lifestyle, and age over 60. If you check more than one of these boxes, be proactive. The diagnostic test for PAD is called the Ankle Brachial Index ABI, a simple, non-invasive comparison of blood pressure in the ankle versus the arm. If the result is abnormal, further imaging may include ultrasound, CT angiography, or MRI. Treatment often begins with lifestyle changes, quitting smoking, managing blood sugar, walking, exercise therapy, and in some cases medications to improve circulation. For severe cases, surgical options like angioplasty or bypass may be necessary. Many people ask, is PAD reversible? While blocked arteries can't always be cleared naturally, early detection and management can slow progression and reduce symptoms drastically. Don't wait until cramps keep you from walking across the room. If your leg pain comes with movement and fades with rest, your arteries may be quietly closing in. With the right steps, you can take back control before it takes away your freedom. Cause 7. Serious underlying diseases: cancer, liver disorders, autoimmune conditions, lumbar stenosis. When leg cramps persist, despite a healthy diet, balanced electrolytes, safe medications, and regular exercise, it's time to consider the deeper, less obvious causes. In rare cases, leg cramps can be the first noticeable symptom of a more serious underlying disease. These aren't just occasional discomforts. They're signals from within, warning you of disruptions that go beyond muscles or circulation. One such cause is cancer. Certain cancers, especially those affecting the lymphatic system, liver, or nervous system, can interfere with your body's ability to regulate minerals and fluid balance, leading to frequent unexplained muscle cramps. Even if you're consuming enough magnesium, potassium, and calcium, your body may not be absorbing or processing them correctly. These hidden imbalances can manifest as nighttime cramping, muscle twitches, or ongoing fatigue. Liver disease, particularly cirrhosis, is another critical factor. The liver is central to your body's detoxification and nutrient storage systems. When its damaged, electrolyte processing becomes impaired and toxins may accumulate, causing painful cramps, especially in the legs. Many patients don't even realize they have liver disease until advanced stages because early lab results can appear deceptively normal. That's why it's crucial to evaluate persistent cramps alongside other subtle symptoms like fatigue, changes in skin color, or swelling. Autoimmune conditions like lupus, rheumatoid arthritis, or multiple sclerosis can also cause leg cramps due to inflammation of the nerves, vessels, or muscle tissue. These conditions are systemic, meaning they affect multiple areas of the body. If your cramps are accompanied by joint stiffness, numbness, rashes, or chronic pain in unrelated areas, it's worth pursuing autoimmune screening. Another often overlooked source is lumbar spinal stenosis. This condition involves the narrowing of the spinal canal in the lower back, putting pressure on the nerves that travel down into the legs. Surprisingly, you might have spinal-related leg cramps without any back pain at all. If your cramps are triggered by standing too long, relieved by sitting or bending forward, or accompanied by numbness or tingling your spine, could be the source. One of the most common questions people ask is, how do I know if it's something serious? The answer lies in patterns and persistence. If you've ruled out basic causes, like dehydration medication or activity, but your cramps keep getting worse or are accompanied by other unexplained symptoms, it's time to talk to your doctor. Ask for a deeper workup, blood tests to assess liver function, autoimmune markers, and metabolic panels. Inquire about imaging, especially if spinal involvement is suspected. Most of these serious causes are treatable when caught early, but the longer they go undiagnosed, the more damage they may cause, not just to your legs, but to your entire quality of life. Remember, your body is not betraying you. It's communicating with you. Chronic unexplained leg cramps are not something to ignore. They could be the whisper before the scream, and that whisper might just be the chance to change everything. Start today by reviewing how much real salt you're actually consuming, and consider adding one magnesium or potassium-rich food to your next meal. For the next 7 days, keep a simple cramp journal. Record the time intensity and what you were doing before it started. If symptoms continue into week 2, begin adjusting your routine. Eat more fatty fish, drink more water, and reduce or review medications. By week 3, consult your doctor with your notes in hand. Have you ever experienced leg cramps from something unexpected? Share your story in the comments. It could help someone else. And don't forget to like, subscribe, and stay tuned for more life-changing insights.